The Bureau of Economic Analysis published its revised GDP data for the first quarter of 2023. The new estimate shows that GDP increased at an annual rate of 1.3%. This comes as congressional leaders and President Biden have yet to agree to a plan to tackle the debt ceiling. Many Americans are concerned at how a default could impact their health care. For more on this, let's bring in Sara Rosenbaum. She's a professor emerita at George Washington University's Milken School of Public Health. Thanks so much for joining us, Professor.
Thank you for having me.
So let's begin with the Affordable Care Act. How could a default, as far-fetched as it could be, but how would that impact health coverage if one were to come?
Well, the Affordable Care Act is essentially a remaking of the entire American healthcare system. It changed insurance rules, it expanded coverage, it changed the way healthcare gets delivered in the United States. And I think it's important for your listeners to understand that we all use the same healthcare system. We may live in different communities, but we all go to the same hospitals, we all see common doctors, we all go to the same pharmacies. And so the focus is not just on the people who became newly insured under the Affordable Care Act, more Medicaid beneficiaries, people able to go and shop for affordable insurance in their marketplaces. But it really is going to have an effect on everyone because all the money that comes, whether it's from private insurance or public insurance or our employer plans, all ends up in the same system. And when the government stops paying its share of the bills, the system really can't function. The effect is just too big.
And then I guess you throw in Medicare and Medicaid, and that adds to the problem.
Well, yes, and I mean, just to give your viewers some startling statistics, in the United States, most hospitals report that half or more of their inpatient days come from Medicare or Medicaid. In other words, half of all the money coming into hospitals to operate them, their inpatient services, surgeries, serious medical needs, are flowing from public insurance. So if suddenly that money is turned off like a tap because the government can't pay its bills, the hospitals simply can't function. It would be like saying to a grocery store, you're going to lose half of all of your revenue, but please keep your staff in place and please keep buying food and please stay open. It just can't happen.
So, you know, Vlad said kind of as far-fetched as it can, because we've gone to the edge, but we've never actually gone over the edge. But when you say a hospital simply can't function, what will we see? As your best guess, will we see surgery cancellations? Will we see, staff being scaled back?
Yeah, well, I certainly assume that hospitals, if their revenue flow from public insurance is cut dramatically, are going to have to, exactly as you know, start laying off their staff, start canceling surgery, start trying to avoid any care but absolutely essential services. And even then, it will be hard. Some hospitals, because they're so dependent on Medicare and Medicaid, like rural hospitals, especially large urban hospitals, may not even have what it takes to operate an emergency department. But I assume that it would be like a shockwave rolling over the entire healthcare system.
Sara Rosenbaum, thank you very much.
Thanks for having me.